Hi, my name is mouza saif almehrzi. I'm in Fatima College of Health Science in Ajman. Today I will present my project in medical terminology. My topic is about eclampsia. Eclampsia is a seizure complexion of pre-eclampsia. It's a serious condition where hypertension results in innings during the pregnancy. Um, because preeclampsia can lead to eclampsia. You may have symptoms of both conditions. However, some of your symptoms may be due to other conditions, such as kidney disease or diabetes. It's important to tell your doctor about any condition you have so they may rule out other possible causes. The following common symptoms of preeclampsia: elevated blood pressure, swelling in your face or hand, headaches, um, also difficulty urinating, vision problems, including episodes with loss of vision of blurry vision. Also abdomen pain, especially in the right upper abdomen. We have a lot of this common symptoms in preeclampsia. Also, patients with eclampsia can have the same symptoms as those noted above. That's why I said it. Or may even present with no symptoms prior to the onset of eclampsia. The following are common symptoms of eclampsia, like seizures, loss of conscience, also the addition. What is the cause the eclampsia? Eclampsia often follows preeclampsia, which is characterized by high blood pressure. So hypertension, it's a high blood pressure in pregnancy. Also, other finding may also be present, such as protein in the urine. If you have protein in the urine, it will cause eclampsia. If your preeclampsia worsens and affect your brain, cause seizures, you have developed eclampsia. Doctor don't ask for sure what causes preeclampsia, but it's thought to result from abnormal formation and function of the placenta. They can explain how the symptoms of preeclampsia may lead to eclampsia. High blood pressure, preeclampsia is when your blood pressure, which is hypertension, or the force of blood against the walls of your arteries become high enough to damage your arteries and other blood vessels. So you have to be careful, and you have to check and go to a doctor to check your health, and to check the baby health also. Who is at risk of eclampsia? Being older than 35 years or younger than 20 years, pregnancy with the twins or troubles, first time pregnancy, diabetes or other condition that affect your blood vessels. Also, the kidney disease, it's a cause eclampsia also. The eclampsia in your baby, preeclampsia and eclampsia affect the placenta, which is the organ that delivers oxygen and the oxygen and nutrients from the mother blood to the fetus. The fetus is the baby. When high blood pressure, when the when hypertension, sorry, reduce blood flow through the vessel, the placenta may be unable to function properly. This may result in your baby being born with a low birth weight or other health problems. So you need to be careful and you need to go to doctor and check of your health and for your baby. Also, how is eclampsia diagnosed? Blood test, keratin test, urine test. Also, maybe they have a lot of tests you need to check and see if you have eclampsia or no. The treatments of eclampsia, delivering your baby and placing are the recommended treatment for preeclampsia and eclampsia. Your doctor will consider the severity of the disease and how major your baby is when recommended timing of delivery. If your doctor dangerous you with mild preeclampsia, they may mention your condition and treat you with medication to prevent it from turning into eclampsia. So also we have the medication to prevent seizures called anticonvulsant drugs. It's like a drugs may be necessary. You may need medication to low blood pressure, hypertension. If you have high blood pressure, you may also receive steroids which can help your baby lungs to deliver. That's it. Also, the prevalence of eclampsia globally is reported to be 0.3%. This is based on secondary analysis of a World Health Organized. Eclampsia often follows pre-eclampsia, which is characterized by hypertension. In the UAE, its affect about 2% to 8%. Also, this condition can have impacts on material and fetal health in the immediate and long term. For the mother, this includes a 2 to 4-fold increased risk of long-term hypertension. For the fetal, this includes antenatal risk of intrauterine growth, which is IUGR, preterm birth, most commonly iatrogenic, and fetal distress and fetal death in utero. Utero only for women. That's the baby dead in this or death in this uterine. So we need to be careful and check of baby's health and the mother health. Also, we have a lot of the risk factor in the eclampsia. Chronic hypertension, first pregnancy, age, multiple pregnancy, history, health, family history. We have a lot of things to make this condition of disease. The cause of hypertension and a pregnancy was thought to be due to this depressive thoughts as a result of marital conflict and worries, while seizures and pregnancy were perceived to result from prolonged exposure to cold. Also, maybe the woman it's have a problem they think, or something that's make the woman she have a hypertension, but she need to be careful um, about her health and baby health. Also, she need to check on doctor and check baby doctor to see and to be safe. Also, uh, they have to be relaxed and think about something good and eat carefully. They don't need to eat more salt or more sugar because the pregnancy maybe she have a diabetes or hypertension or something, the glucose. So also she need to um, check her glucose and check the blood pressure and see the pulse of baby and the health of baby for the oxygen, for everything. So the woman who pregnancy, she need to go for a doctor every month, and she need to get all the medicine or vitamins or whatever she can take, or whatever the doctor wrote it for her to eat to stay safe. Um, Also, she need to be safe, and she didn't need to think about anything. She need to stay and relax, because she need to be okay and the baby okay. Because if the mother have eclampsia, the baby maybe will death in utero, so that's more dangerous for the woman and for baby. um, that's it. Thank you so much. Have a nice day. Bye bye.